Live Talk 100.3.
Let's begin talking to our studio guest. The first one in the studios is Dr. Nikolas Valsamidis. He is a laparoscopic and bariatric surgeon in Dubai at Fakeeh University Hospital. But we're also going to be talking about something that we've never spoken about on the show, which is sports hernia and more. Hi, doctor. How are you doing this morning?
Good morning. I'm doing very well. Thank you. Thank you for allowing me to be here and talking to your listeners.
It's our pleasure, doctor. Before we begin, if you can tell us a little bit about yourself, how long have you been in Dubai and where were you practicing before that?
Sure. I've been in Dubai for a little bit less than a year. Before that, I was practicing as a consultant general surgeon in Greece, where I'm partly from, for the last 12 years. Before that, I was working for 10 years as a consultant in Scandinavia, in Denmark and Sweden.
Right. Since you've worked in two very diverse markets, two very diverse countries, what's the major difference that you see in both?
The weather.
That's it.
No, I'm just kidding. Practicing medicine in Europe is more or less the same as in Dubai. I would say the standard is very high here in the UAE of medicine, and the people are just as friendly. So for me, there is not much difference. I can help my patients in Europe, and the same way I can help my patients here in Dubai. So.
Since you said weather was the first thing that came to your mind, do you also feel that because of weather there are certain ailments that are impacting people there, and then there are certain ailments very specific to the UAE in your line of business?
Sure, of course. There are other diseases that you have to treat when you work in a more cold climate like in Scandinavia. Absolutely. And the population there is, they suffer from conditions that are very specific for the climate. And
the colder climate, yeah?
Absolutely. Yeah.
So do you think the colder climate, I'm sorry, I'm digressing and we will jump
absolutely.
into your
That's
topic,
my
but
pleasure, yeah.
Do you think the colder climate comes with more issues than like a very hot climate that we're living here in the UAE?
Yeah, well, I don't think we can categorize it like that. Cold climate, yes, it does give a rise to other kinds of diseases than the warm climates, but vice versa. There are other things here in the heat that we need to take into account. Also, it makes a difference with the rehabilitations after surgery. Being in a hotter climate makes the rehabilitation easier, actually. So, yeah, there are differences.
Hotter climate makes rehab easy?
Yeah, it does.
Okay.
It does.
All right. Now, you are also dealing with sports hernia, but you
Sure.
are a bariatric surgeon. You do laparoscopy as well. How does all this fit in?
Yeah, well, I like to call myself as a minimally invasive surgeon. That's what I do. I do laparoscopic and I do robotic surgeries. This is a big spectrum of diseases and conditions. And one of the major is hernia repair. Hernia repair is done minimally invasive nowadays with laparoscopic and robotic surgery. This is what I'm trained to do. And also bariatric surgery. It's upper GI, upper gastrointestinal disease, and we treat that with minimally invasive techniques as well.
Okay, but in a typical day, what kind of conditions do you see the most?
Well, the most obvious conditions that come to my clinic and to my attentions are the acute ones, like if you have an appendicitis, for example. Then you come to meet somebody like me, because then the treatment is an operative, and we do a laparoscopic appendicectomy, as it's called. Gallbladder disease is also a very common condition, but hernia, absolutely, it's up there. Hernia repair, whether it's a groin hernia or umbilical hernia or even deep hernias like reflux diseases and heartburn, which is called the hiatal hernias. Those are also treated by me, by me. And then we have the more serious conditions, just like tumor cancer, which can be treated with the operative techniques that I use.
Okay, but what exactly is hernia?
Hernia is basically let's say a break or separation of muscle tissue in the abdominal cavity. So when the muscle tissue, which provides the wall of our abdominal cavity, when it tears and it separates from each other and makes a hole basically, then the soft tissue from the abdomen, the fat, and sometimes the organs, like the intestines, they can protrude through this separation of muscles, and then you can see a bump or a bulk.
Where would it typically occur?
Typically in the groins, which is then it's called an inguinal hernia. And one of the early stages of inguinal hernia is the sports hernia that we were going to talk about.
Yeah.
Another typical place will be the umbilical, the belly button, where then it's called an umbilical hernia. And then you also have hernias in old operative incisions. They're called incisional hernias. You have hernia in the above the umbilical. A lot of people, especially if they put on gain weight fast, or
Cause of hernia,
they get a separation, and then it's called a midline hernia.
Okay,
Yeah.
all right. And what exactly is sports hernia?
Sports hernia, basically, or athletic pupalgia, as it's also called, it occurs in the soft tissue between your lower abdomen and the groin. It's a tear in the muscles and the tendons in your groin and abdomen. The sports hernia can also cause nerve irritation, making the affected area sensitive and uncomfortable. So basically, the symptoms are the same as a true hernia, but it's not really a true hernia, because a sports hernia you can't see anything. You don't see a bulk, something bulking out. You don't see a bump protruding from your abdomen, but the symptoms are exactly the same as a true hernia.
Right.
And the treatment is also the same.
And I'm assuming it doesn't only happen to sportsmen, right?
Absolutely not. It's important to remember that you don't have to be a professional athlete to suffer for serious exercise injuries. In fact, those who play for leisure are still very likely to sustain sports injuries, especially as they age. Muscle strains and cramps are often of the most common, and groin strains in particular can be very painful. They are often identified by a sharp pain inside the upper thigh, and sometimes you may experience a snapping or a popping sensation before the pain begins. So sometimes a groin hernia is referred to as a sports hernia because the pain can be so intense, affects a specific similar area, and can lead to loss of function or strength.
Now, doctor, one of the things that comes to my mind is how can someone differentiate between a sports hernia or any other hernia or a groin strain for that matter?
Sure. Sometimes a groin strain or a sports hernia is referred to, which is also referred to as a sports hernia, because the pain can be so intense, as I said, and affects a specific similar area. So it's very difficult to differentiate sometimes. A true hernia or an inguinal hernia involves a breakdown and separation of muscle tissue to the point that fatty tissue or part of the digestive tract, like a piece of the intestine, protrudes through. In addition to severe pain, you can feel a bulge or a knot at that site. That is not the case with sports hernia. Sports hernia, it's about the pain. It's exactly the same pain as the true hernia, but you don't see these bulging. You don't feel a knot.
Okay, but can it be avoided, or if someone has it, can it be left untreated?
We're talking about the sports hernia, right?
Yeah.
Well, prevention is better than cure. That's for sure. This is especially true for sports hernias. Unlike an inguinal hernia or true hernia, sports hernia won't develop spontaneously. Specific actions weaken and tear the deep layers of your abdominal muscles. However, preventing a sports hernia, it's not always easy. Even the slightest imbalance is easy. even the slightest imbalance puts strain on your abdominal muscles. So if you regularly participate in physical exercise, you should consider taking a hernia prevention program. This program teaches you how to exercise safely. You will likely do some exercises to strengthen your core and your abdominal muscles. But even if you don't join the sports hernia prevention program, you can slowly condition your body to strenuous physical activity by building up.
Yeah, but how is it diagnosed?
Well, there are many injuries and conditions that can cause pain in your abdominal or groin area. So it's challenging to diagnose a sports hernia, that's for sure. But as mentioned before, it's also difficult to pinpoint your pain as it radiates over a large area. So when the patient comes to the doctor, it's not always obvious. A thorough examination is needed of your current health and medical records, and it's a good place to start when diagnosing a sports hernia.
And how do you treat it? Is it treated just like any other hernia?
Well, no. A true hernia is always treated surgically. It requires an operation. Whereas with the sports hernia, if it's still in the early ages, you can resort to non-surgical treatments. However, a more severe sports hernia, so if the clinical picture or the symptoms are more severe, then it requires surgery. A non-surgical treatments, since we're talking about them, they are resting. Obviously, if you rest for if you do get a pain in your groin and it's diagnosed as sports hernia, then the first part is resting for 7 days, for a week or 10 days after the initial injury. So this is the one way to combat sports hernia, and you can also apply ice to the injury while you're resting. Then there is also drugs, anti-inflammatory, non-steroid anti-inflammatory medication that reduces the pain and the discomfort, but it also has a healing effect.
All right.
And then lastly, the last non-surgical is the physical therapy. You can start physical therapy exercises immediately after the initial acute phase with the pain, so no less than 2 weeks after your initial injury.
All right, we'll continue talking about this with Dr. Nikolas. If you have any questions on your mind, 0586861003. We're talking about sports hernia, different kind of hernia, and also he's a laparoscopic and bariatric surgeon at Fakeeh University Hospital.
The smooth music and life talk with Ronak Kotecha. This is Talk 100.3.
And to win good health, of course, listen to Talk 100.3, especially to live talk, जहाँ पर बड़े बड़े डॉक्टर्स आते हैं, बड़ी बड़ी हेल्थ की बातें करते हैं. आज हम बात करें स्पोर्ट्स हर्निया की and all the related stuff. So now, doctor, one of the questions that is coming for you is from Daniel. He's asking how to prevent sports hernia. Like you already said it, but if you can just sum it up for us.
Yes, sure. Well, as I said, prevention is much better than the cure. So there are specific programs, physical exercises that you can take to strengthen your core muscles, and you can strengthen your abdominal muscles. If you gradually build up towards strengthening your core and not go 100% into difficult exercises, then you can prevent getting a sports hernia.
A sports hernia, all right. And are these hernias associated with a certain kind of sports or certain kind of activity? That's also a question that is coming for you.
Yes, the type of injury that is caused when you have a sports hernia is it happens due to strenuous and constant twisting. So it's very relatively common injury in sports that everybody knows, like in tennis, in basketball, in soccer.
Twisting
football.
any part of the body or just
Twisting? Yeah, what do you mean? I mean,
no, like where you said
when we twist our hips and our abdomen compared to our legs, yes.
Okay, then there's a higher risk of
yes. So as I said, tennis, basketball, soccer, hockey, football, and running, of course, track and field.
Okay. There is also a question for you from Sonal. I mean, it's different from what we're talking about.
Sure.
She's asking about varicose veins. Are there any permanent cure for this? What exactly are these?
Well, varicose veins are the formations that we see commonly on ladies on the legs, where you see like worm-like formations. They are the veins. They become sick, and they with time and from excessive standing up.
Yeah, prolonged standing in the kitchen, maybe.
Exactly. And then they formed. Yes, there are different, depending on the degree of the varicose veins. There are different kind of treatment. For lesser degrees of varicose veins, you can treat it with stockings and life changes. But more difficult conditions, they require surgery.
But a lot of people just leave these things just as is. They really don't go for a treatment. As is the case with hernia, like I was telling about my father, he has some sort of hernia which pops out and pops in, like, and he's got like multiple other comorbidities, so we don't really bother with that. He's 70. So it's left untreated, basically, is what I'm trying to say.
Yeah. Well, my recommendation, or when you have a true hernia, something is protruding, like with your father, he has a inguinal hernia, then my recommendation is to definitely go for surgery, whether you are young or old, or where you have comorbidities. Of course, you don't take them lightly, but surgical treatment needs to be done, because if you don't do the surgery, the complications are very serious and life-threatening.
But if it's not affecting your day-to-day life,
I mean, it will always affect your day-to-day life in some degree, even on old people. It does, because they know that they have it. They are aware of the hernia, and it limits their movements and limits their daily.
Then let me
routine.
ask you, how risk-free are these treatment options, and is a surgery always required?
For true hernias, surgery is always required, because the complication, as I said, can be life-threatening. If a hernia is, usually hernias are easy to pop in. With your hand, you can just pop them back in, and it feels for a few minutes, it feels good, but after 5 minutes, it just spontaneously pops out again, hernias, and the risk is that you won't be able to pop it in, and then the organ that is stuck in the hernia can be twisted or malrotated, and then you get an acute condition that needs immediate surgical intervention.
Okay, and once you treat the hernia, is there a long recovery period?
If we're talking about true hernias that are operated,
when you say true hernia, like
true hernia, that something is popping out. That is the definition of a true hernia, as I said before. Whereas sports hernia are hernias that nothing is really protruding out. It's only the muscle injury that you need. But that's why sports hernia is considered a pre-stage for a true groin hernia, and that's why you can.
All right.
Yeah.
Okay. Now, you also are a bariatric surgeon and a laparoscopic surgeon. So that's moving to a little more interesting, rather, and more elective sort of surgeries are happening in this field. Mm-hmm. What kind of problems do you usually encounter as in that particular field?
What do you mean
in laparoscopy and bariatric here?
Yeah, well, as I previously mentioned, laparoscopic surgery is it covers a big area of conditions, from simple, like as I said, appendicitis or gallbladder stones, to more complex procedures as obesity surgery, as you mentioned, or bariatric surgery. But even more complicated than that, we use laparoscopic surgery for cancer cases. Tumors in various internal organs, like gynecological organs or intestine tumors.
So your field is very vast. You see a range of conditions, a range of people, and a range of ailments. Do you think people know exactly where to go when there's so many complex problems occur in our bodies? Do they have a general idea? Do you see that awareness in people? of going to the right
it's
surgeon?
it's getting better, but on the same time, medicine is getting very complicated, and we are able to treat a vast a vast spectrum of conditions, and therefore it's understandable that people, they don't really know who to address or who to go to. So that's the role of the family doctor and the role of the general practitioner.
Right. But can you explain what bariatric surgery exactly is, and how does it really help in treatment of morbid obesity?
Bariatric surgery is a field where you do surgery to treat morbid obesity. Morbid obesity is defined as a condition, or better said, a disease nowadays. We call it a disease, we don't only call it a condition, where the BMI, the body mass index, is greater than 40. Or it's greater than 35, but you also have to have two comorbidities that are related to obesity. Like diabetes, like hypertension, or muscle and back pains, or you can have apnea, sleep apnea, where you don't breathe for a long time, a long period during at night. Those are considered comorbidities. Yeah. So the operations that we do to treat these diseases, this condition, morbid obesity, they are categorized under bariatric surgery. Yeah.
All right. And what are the most common misconceptions about bariatric surgery that you encounter in general? I mean, I'm sure there's a lot of awareness that you have to spread before you actually get into diagnosing and treating conditions.
This is a big discussion. Yeah. A lot of people, they think that there is only one type of bariatric procedure, which is not true. There are different kinds. I can just, out of my head, I can come up with 5 or 6 different procedures. So they don't always all work the same way, and they are meant to be used for a specific type of patients. So it's very important that you choose which procedure to perform
is right for you. Which
one is right for you, exactly.
But that's something that only you can say, and you can.
No, it's not only my opinion. It's an opinion. It is a decision that is taken after a long discussion with the patient and the doctor, and then together they come up with which procedure is best suited for him. Yeah.
But when it comes to these kind of surgeries, there are a lot of private clinics also that operate. We've seen in the UAE, especially if you go on the Jumeirah side, and so many of them. And there's a lot of vanity attached to it. A lot of people want to do these surgeries just to look better, look younger. Is there ever a time that when patients come to you for this, you say, you advise them against it, that there's probably going to be more harm to you than good?
Yeah.
Maybe you can wait for a few more years. Yeah.
That's a very good question. Yeah, and I have to say that it happens to me very often that I tell the patient that comes and seeks me to have a bariatric procedure. I tell him that this is not for you. It's maybe they only need to lose like 5 or 10 kilos, or maybe they have or they're too old, or they're too young. There are many conditions where we have to avoid talk to the patient out of this
the surgery.
The surgery.
Do they generally listen to you, or they
yes, of course,
go to the other doctor?
Well, they might go.
Opinion.
Yeah, they might go to get a second opinion. But
what's your take on second opinions as a doctor?
No, I'm all for it. I mean, when you do difficult operations, difficult procedures, one of the alpha and the omega of the outcome is patient's compliance. And what do we mean by patient compliance? Is that the patient fully understands what he or she is about to walk into, And one of the ways, of course, we have Dr. Google nowadays, but we also have the first opinion and the second opinion, sometimes a third opinion. All that, I'm all for it because it makes the patient compliance much more effective. And
but it sometimes can also be confusing. And I know,
absolutely.
I mean, when I was deciding for my father, especially for the CABG, for the bypass surgery, and going for second opinions, I would always feel that the doctor who gave the first opinion will always feel that, he doesn't trust me, trust me enough that he goes to the other doctor.
No, I don't see it like that.
I'm glad doctors don't see it like that.
I've been around for many years, so I know that patient. I've been a patient myself, So I'm glad that they seek to understand exactly what they go into.
Right. We'll move into a song now, but before we do that, I also want to ask you, like, when it comes to bariatric surgery, which kind of patients do you generally recommend that to?
Well, I definitely recommend it to people that are between 18 and 60 years old, or maybe even sometimes 65, and they have a body mass index greater than 35. Because I know that a lot of people, they go for the Ozempic or the Mounjaro injections nowadays. It's very hype talk about that, but it's not for them. It's not for them.
Who is it for them?
Injections are they're a great thing. They are one of the big discoveries of the 21st century, absolutely. But they are for those that only seek to lose 10 to 15 kilos, and I'll never get tired of saying that. It's not for those that have to lose more than 50 kilos. It's not.
It's not for them, of course.
No.
But as is the case with most surgeries, with bariatric surgery, also some risks are associated, right?
Absolutely.
It can also be life-threatening, isn't it? We've got a question for you. That's why I'm asking.
Sure. Yeah.
The question is, what are the risks associated with bariatric surgery?
There are many risks, and you don't take it lightly when you go into deciding to have a bariatric surgery. So you need to know the risk, what you're getting into, and it's up to the doctor also to inform you about all the risk, and it's up to the doctor also to make sure that everything is covered, that the complications that are associated with these difficult surgeries are taken into account.
Absolutely, and as always with every surgery, the risks have to, the benefits have to outdo the risks. The benefits have to be much greater than the risk that you're taking by putting your body under the knife. We'll continue talking to Dr. Nikolas. We'd like to know about some great stories of success stories or heartwarming stories that you've experienced, maybe not in Dubai, maybe in Greece, maybe back in Scandinavia. So stick with us, 0586861003. If you have any questions on your mind for Dr. Nikolas, he is a laparoscopic and a bariatric surgeon with Fakeeh University.
This is Talk 100.3.
And we have Dr. Nikolas still with us. Just your last chance if you want to ask any questions to him regarding bariatric surgery, laparoscopic surgery, sports hernia, any kind of hernia. Doctor, like I was telling you, I want to know some of the heartwarming stories because you have such vast experience across different countries, in Greece, in Scandinavia, back in here in Dubai.
One that pops into my head was something 15 years ago. I was in Greece back then, and I was a young track and field athlete came to visit me, and I knew him because he was very promising as a 20-year-old when he was. That's how old he was when he came to see me. But he was suffering from a growing pain, and after I sent him for some investigation, an MRI, we figured out that it was a sports hernia. So I did the operation on him because it was really not allowing him to train properly. And 2 years after he did the surgery with me, he came very, very close of breaking the world record in long jump, which is amazing. I remember he jumped 8 meters, 68 centimeters or something like that. I was very close to the world record. So that's a very heartwarming story. And then And another one that pops into my head is a record-breaking at that time weight. One of my young patients, he was 30 years old, and when he came to me, his body weight was 275 kilograms.
Oh, okay.
Yeah, and he was 30 years old, as I said, and he was lying in bed all the time, and his physical condition was deteriorating. He wasn't married. He couldn't get a girlfriend. So we did a Roux-en-Y gastric bypass on him, and a few years later, and today, his body weight is 80 kilograms. He's married. He's happy. He's 40 years old now. He has 3 daughters, and we're still very good friends, and we keep in touch. Yeah.
Now, I'm sure you must have heard about the Ambani wedding recently that happened.
Yeah.
You know about that, right?
Yeah.
Nobody in the world doesn't know about it. So the groom, his name is Anant Ambani, and he had similar issues. Like his mother came out, Neeta Ambani, and said that, he was highly asthmatic, and that's why he had to be put on a lot of steroids, and which is why he gained a lot of weight. I mean, he had been struggling with weight gain. He did lose about 108 kilos in 18 months a couple of years back, but now he's back to his old sort of, may not be the same weight, but he's pretty much what he used to be before. Again, he is quite, I don't know if you'd call him obese, because he is overweight.
He is overweight, yes.
Yes. Have you followed his story, his case, because he's such a popular figure now?
No, not really. But I don't believe he got operated to lose weight. No, he used medical remedies.
Okay, no surgeries.
No surgeries. But of course, I cannot know the whole truth. But now he's gained back a lot of that weight, and that cannot happen with bariatric surgery. One of the not happen with bariatric surgery. One of the what should I say? Benefits with bariatric surgery is that you lose your weight and you use it permanently. Yeah, exactly.
Even if you don't follow the lifestyle.
If you don't follow the lifestyle, that's one of the tricks of taking the correct decision of which type of surgery you need.
Okay, but when you do bariatric surgery of this kind, of this mammoth proportion, where you lose 50 kilos, 60 kilos, doesn't your skin become all loose? And then how do you tighten that? You'll still be, may not be obese, but you'll still look like a little disfigured,
Yeah, well, not really, because the skin has elasticity, and that elasticity goes away, of course, with aging. Absolutely. So the older you are, when you lose the weight, the more your skin is going to hang. But then you have the plastic surgeons.
Oh yeah, then there are other surgeons as well.
Yeah, exactly. So they can come and...
but this is, of course, it sounds exciting as well as scary, as well as, something that can help people. But how much of it is really covered under insurance?
Depends where you live. Back in Europe...
I live in Dubai.
But back in Europe, for example, it's subsidized by the states, and it's also subsidized by private insurances. In Abu Dhabi, for example, that's exactly the case as well. Whereas in Dubai, it's not covered by your insurance.
Yeah, it's considered as cosmetic, right?
Exactly, which is wrong.
Yeah, it should. I think in days to come, and maybe in years to come, it will change, because
probably
as people see more and more, patients doing it and also getting benefited out of it, because ultimately it also increases your life quality of your life expectancy, maybe.
Exactly, it increases the life expectancy, and that means that you are more productive. So you can make more money by working more efficiently, and
live a better life.
And that's why it's subsidized by public and private insurances in Europe. Absolutely. And even in Abu Dhabi. You don't have to go far.
Yeah. And also, correct me if I'm wrong, but some patients who have chronic diabetes or any such,
it's cured.
They come to you for bariatrics.
It's
right?
cured. It's cured. I can tell you for a fact in Sweden, because that's where I'm trained. My surgical skills, I have it from my days in training in surgery in Sweden. In Sweden, the Roux-en-Y gastric bypass it's a procedure that is done not on one of the indications, not only obesity, but it's also type 2 diabetes. So if you have type 2 diabetes and you're not obese, you can go and have a Roux-en-Y gastric bypass, and then your diabetes is cured.
But then if diabetes is getting cured like this, and why is it that not many people know about it or do it?
They know about it, and
Why
a
don't
lot
they
of
do it
people do it. But unfortunately, here in the UAE and in Dubai in particular, everybody has private insurances, and they don't cover it.
And the one thing about healthcare is that ultimately, the more the person is staying with that condition, the more he's having the pills, and the more is
it's a vicious circle.
It's a vicious circle at the end of the day.
Exactly.
Yeah, but it's great that you've the reason I'm dipping into these kind of experiences of yours is because you worked you've studied in Sweden, you worked in Greece, and then back in Scandinavia, and now you're here. And your favorite show is what? Grey's Anatomy. You do look like one of those characters from there. Yeah.
Californian characters, right?
Yeah.
No.
Do you watch these shows, that depict the hospital life?
Grey's Anatomy, no, not really. But I did, what's it called? What's the other show called? Dr. House, I think?
Dr. House,
that was a
You
great
look like
show.
him, yes. Yes, you look like Dr. House, absolutely. All right, before we let you go, almost at the end of the hour, what's the new technology that you're using in all these surgeries, whether it's hernia or it's bariatrics, and what are you excited about?
The future in surgery for hernias and laparoscopic surgery is robotic surgery, and I'm happy to say that now in Fakeeh University Hospital we just acquired a new robotic system that's going to help us do these kind of surgeries with the latest technology. But robotic surgery is the future. What does it mean to have a robotic surgery? It means that you're going to get exactly the same laparoscopic surgery, so minimally invasive, only small incisions in your abdomen to do major complicated surgeries, but you'll be able to have it done with much more precision.
It definitely doesn't mean a robot doing it.
It's not a robot doing it, it's the surgeon doing it.
It's still Dr. Nikolas.
It's still Dr. Nikolas. It's just that Dr. Nikolas can use the robotic arms to achieve greater...
So you will be handling the robot, basically?
The robot is not doing anything by itself. The surgeon is doing the surgery.
Okay.
The robot, and in the future maybe AI technology, will be able to minimize the twerking, the minimal twerking that it's inevitable for a human hand to have. And
it'll be more steady. The hand will be more
steady, and the picture is amazing already. Now the technology offers you a picture, a three-dimensional picture. It's like going to a 3D movie.
Mm-hmm.
When as a surgeon, when you get access with the camera in the abdominal cavity, it's a 3D picture.
So there's more clarity, you have more perspective.
Clarity, it's a perception of depth, which is very important.
Amazing. And you don't see AI or any of these robotics taking away any of the jobs in your field?
No, they will not take over the job. They will make the job easier.
They'll just aid you.
They will aid me, yeah.
And God forbid if some global IT outage happens, certainly don't want a blue screen.
No, absolutely not.
Don't use Microsoft or CrowdStrike. Thank you so much, Doctor.
Thank you.
That was really, really amazing, and we hope that you have a great, wonderful, rewarding career here in Dubai, and you continue saving lives.
Thank you so much. I'm looking forward to it. Thank you.